السلام عليكم ورحمة الله وبركاته. طلاب الأعزاء، رمضان مبارك عليكم إن شاء الله. Today we will start the first lecture in our second term, which is salivary gland diseases. You must know that the most common representing complaint of the patient with a salivary gland disease is the oral dryness, xerostomia, and glandular swelling or a mass. Swelling or a mass around the parotid or the submandibular area. You know that we have many classifications submitted for salivary glands. It's either major and minor groups of salivary glands. The major consisting of three major glands: the parotid, submandibular, and the sublingual. The parotid and the submandibular glands drain into the mouth in a single long duct, while the sublingual glands drain via many small ducts. The major salivary glands can also be classified based on the saliva constituents or salivary consistency according to a Zener cell type. That means serous or mucus or a mix of both. Serous cells produce more watery enzyme-rich saliva, while mucus cells secrete a more viscous fluid with plentiful salivary glycoproteins known as mucins. Of course, the parotid gland is composed primarily of serous cells, while submandibular considered mixed between mucus and serous types, while the sublingual and the minor salivary glands are mainly of mucus type of saliva. Besides that, there are also between 600 and 1,000 minor salivary glands scattered all over the oral cavity, named according to the site. That will be labial, minor salivary glands, buccal, lingual, palatal, or retromolar. In addition, there are three sets of minor salivary glands of the tongue. First, glands of Weber found along the lateral border of the tongue. Glands of von Ebner surrounding the circumvallate papilla, that means the posterior third of the tongue. Last, glands of Blandin and Nunn, also known as the anterior lingual glands, found in the anterior ventral tongue. Parotid saliva is secreted through what is called Stenson's duct, the orifices of which are visible on buccal mucosa in the vicinity of the maxillary first or second molar, while the submandibular gland saliva is secreted through the Warthen's duct, which drains saliva from each submandibular gland and exits at the sublingual caruncles on each side of the lingual frenum. The sublingual glands are drained by 8 to 20 excretory ducts called ducts of Rivinus. Largest of all, named Bartholin, joins the submandibular duct to drain through the sublingual caruncle. You remember that we discussed that in the first lecture. One of the anatomical variations that is found is the caruncles. The sublingual caruncle is a small papilla near the midline of the floor of the mouth on each side of the lingual frenum. Most of the remaining small sublingual ducts open separately into the mouth on an elevated crest of the mucous membrane. Now you know there are a few subscriptions like whole saliva. The mixed fluid content of the oral cavity is a hypotonic fluid relative to blood plasma and is composed of secretions from the major and the minor salivary glands. It is composed of more than 99% water, less than 1% proteins and salts. It may also contain variable amounts of gingival crevicular fluid, microorganisms, food debris, exfoliated mucosal cells, and mucus. The most common presentation of salivary gland disease is xerostomia, as I mentioned before, which is a subjective complaint of a dry mouth that we cannot felt it or examine exactly, but the patient describes it. Hyposalivation refers to a quantified reduced salivary flow rate and may or may not be accompanied by xerostomia. You have to differentiate between the two. Similarly, xerostomia may or may not be associated with hyposalivation and can be a result, for example, of a change in the salivary composition to a greater mucus content. While hypersalivation or tylism, with the silent P, refers to an increase in production of saliva and or a decrease in the oral clearance of saliva. Salivary gland dysfunction is commonly used to indicate decreased salivary flow or another quantifiable alteration in the salivary performance. Now we will come to list few causes of salivary gland hypofunction. First of all, medications. Many medications that even prescribed in dental practice can cause dry mouth or hyposalivation or xerostomia, called xerogenic medications. Antidepressants, anticholinergics, antispasmodics, antihistamines or antihypertensives, sedatives, diuretics, and bronchodilators. Other agents like caffeine, alcohol, cigarette smoking, irradiation to the head and neck, external and internal beam radiation, therapy for cancer patients, systemic diseases like diabetes, psychological conditions like depression, malnutrition as in bulimia or dehydration, autoimmune diseases in Sjogren's syndrome, for example, or in anxiety. How we can differentiate between salivary gland hypofunction causes. Autoimmune, chronic graft versus host disease, Sjogren's syndrome, developmental, like salivary gland aplasia, will come later to explain it. Iatrogenic, like radiation, internal or external beam. Post-surgical adenectomy or ductal ligation, Botox injection, may be an inflammatory cause, IgG-related disease, infections, viral, cytomegalo, HIV, hepatitis C, or granulomatous disease like TB, may be medication associated or neoplastic, benign, and malignant salivary gland tumors. We will discuss that throughout the last part of our lecture. Non-neoplastic like sialolithiasis or salivary stones, systemic diseases, anorexia nervosa, diabetes, chronic alcoholism, or sarcoidosis. What can we see or know as symptoms of salivary gland dysfunction? Decrease the fluid in the oral cavity, and this may have an effect on mucosal hydration and oral functions. Patients may complain of the dryness of all the oral mucosal surfaces, including lips, throats, difficulty in chewing, swallowing, and even speaking. Other associated complaints may include oral pain, burning sensation, chronic sore throat, and pain with swallowing. The mucosa may be sensitive to spicy or coarse foods, limiting the patient's enjoyment of meals, which may compromise nutrition. The need to sip liquids to swallow food or difficulties in swallowing dry food have all been highly correlated with measurable decrease in secretory capacity. Clinical examination. Extra and intraoral examination will include signs of mucosal dryness, candidiasis, enlargement of salivary gland, viscous or scanty secretions, طبعا هنا راح نشوف بالإكزامينيشن إنه أكو هذه الساينز that we can evaluate by ourselves. طبعا ممكن نقطة منها أو أكثر. Number 2, enlargement can be associated with a variety of inflammatory, infectious, or neoplastic and other conditions. Cloudy exudates may be a sign of bacterial infection. The exudate should be cultured if it does not appear clear, particularly in case of enlarged gland. Function of the facial nerve when evaluating parotid tumors, طبعا it can be compromised. Tumors of the minor salivary glands are usually smooth masses located on the hard or the soft palate. And lastly, ulceration of the overlying mucosa should raise suspicion of malignancy. Okay, bilateral parotid gland masses are usually due to either lymphadenopathy or Wharton's tumor. هذه التيومرز اللي تخص الباروتيد. Lymphoepithelial cyst, enlarged lymph nodes in the setting of HIV or Sjogren's syndrome, rarely other salivary gland tumors such as acinic cell adenocarcinoma. Multiple painless masses within a single parotid gland may be due to Wharton's tumor, lymph nodes, metastatic disease, other benign and malignant tumors. Tumors in the submandibular or sublingual glands usually present as painless, solitary, slow-growing mobile masses by manual palpation with one hand intraorally on the floor of the mouth and the other extraorally below the mandible. It is necessary to evaluate the glands adequately. Tumors of the minor salivary glands are usually smooth masses located most commonly on the hard or soft palate, but may present anywhere the minor salivary glands are present. احنا قلنا هي scattered all over the oral cavity. Salivary gland neoplasms arise most commonly in the parotid gland, followed by the submandibular, then the sublingual and the minor salivary glands. The relative proportions of malignant neoplasms is greater as the gland goes smaller. That is, a neoplasm in the parotid is more likely to be benign than one arising in the minor salivary glands. Now we come to imaging for disorders or suspicion in salivary gland hypofunction. First, a plain film radiography. طبعا بأنجلز معينة ناخذ حتى يعني نقدر نحصل على clear view. هي lateral oblique والanterior posterior projections used to visualize the parotid glands. Standard occlusal films can be placed intraorally adjacent to the parotid duct to visualize a stone close to the gland orifice. It is useful particularly for visualization of radio-opaque cyaloliths أو stones and the evaluation of bony destruction associated with malignant neoplasms, and it can provide a background for interpretation of cyalogram. النوع الثاني من الإيميجينج هو السيالوغرافي، وهذا very common for salivary glands. Is the radiographic visualization of a parotid and submandibular salivary glands and the ducts following retrograde installation of soluble contrast material into the stensin or the Wharton's duct. هذه مادة أحقنها حتى تبين لي التفرعات مال الدكت، وممكن بالإكس راي تبدو واضحة جدا، يعني تكون radio opaque. The ducts of the sublingual glands are too small for reliable injection of contrast medium. It provides the clearest visualization of the branching ducts and the acinar end pieces. It is recommended methods for evaluating intrinsic and acquired abnormalities of the ductal system. يعني مثلا الductal stricture, الobstruction, dilatation أو ruptures, and for identifying and localizing cyaloliths. But we have two contraindications for cyalography here: active infection and allergy to the contrast medium. Oil and water-based contrast media are available, both containing iodine, and therefore contraindicated in patients with iodine sensitivity. It will elicit allergic reaction. هذه available radiographic views for cyalography include panoramic, lateral, oblique, and anterior-posterior. Following the cyalography procedure, the patient should be instructed to massage the gland and to suck on a lemon drops to promote the flow of saliva and contrast material out of the gland. الفكرة إنه البيشنت يحفز السلايفا كليرنس حتى هذه المادة تطلع مع السلايفا. After approximately 1 hour, if the substantial amount of contrast material remains in the salivary gland, follow-up visits should be scheduled until the contrast material elutes or it's fully resorbed. مشكلة الكونتراست ماتيريال إذا بقت أول شي تسوي لي obstruction للساليفري outflow، بعدين ممكن يصير عندي extra ductal or extravasated contrast medium. Collection of contrast material in abscess cavities, impaired secretory function. Cyalography performed during active infection may lead to further irritation and potentially rupture the already inflamed gland, while injection of contrast material might force bacteria throughout the ductal structure and worsen the infection. The iodine in the contrast medium may induce allergic reaction, as we said, and can also interfere with the thyroid function test and with thyroid cancer evaluation by nuclear medicine if these are done. Another type of imaging هي الالتراسونوغرافي. The ultrasound usually اللي هو المعروف بالسونار. Advantages for such imaging technique: initial evaluation of the salivary glands, especially in children and pregnant women، لأنه previous imaging techniques تكون بها radiation لذلك تكون unsafe. Evaluating for suspected cyalolithiasis and salivary gland abscesses, differentiating between intra and extraglandular masses, used to distinguish focal from diffuse disease, assess adjacent vascular structure and vascularity, distinguish solid from cystic lesions, guide the fine needle aspiration, biopsy, perform nodal staging في حالة عندي suspicion of carcinogenic activity. It can correctly differentiate malignant lesions from benign in about 90% of cases. Now for radionucleotide salivary imaging, scintigraphy with 99 pertungtate is a dynamic and minimally invasive diagnostic test to assess salivary gland function and to determine abnormalities in gland uptake and excretion. It is taken up by the salivary glands following intravenous injection, transported through the glands, and then secreted into the oral cavity. Only the parotid and the submandibular glands are visualized distinctly, as well as the thyroid gland. It has been used to aid in the diagnosis of ductal obstruction, cyalolithiasis, gland aplasia, Bell's palsy, and Sjogren's syndrome. Now we come for CT and MRI. CT provides a definition of cystic walls, making it possible to distinguish fluid-filled masses from abscess. For visualizing masses that are poorly defined on MRI. For patients who are unable to lie still long enough for adequate MRI, like pediatric, geriatric, claustrophobic, and mentally or physically challenged patients. For patients whom MRI is contraindicated, the disadvantage of CT include radiation exposure, of course, administration of iodine-containing contrast media for enhancement and potential scatter from dental restoration أو حتى اللي عنده implant ممكن. MRI provides images for evaluation, salivary gland pathology, adjacent structure, and proximity to the facial nerve. ولكن ال MRI contraindicated in patients with pacemakers أو implants such as aneurysmal bone clips. If the implant contains magnetic metal, it cannot be performed. However, dental implants are not magnetic and are not contraindicated. Patients who have difficulty maintaining a still position, patients with claustrophobia. عندنا أيضا ال CBCT أو ال cone beam CT is increasingly being employed in dentomaxillofacial imaging since it provides high spatial resolution of osseous structures at a lower dose of radiation than conventional CT. Using a cone-shaped X-ray beam and two-dimensional detectors, the CBCT scanner collects volume data by means of a single rotation taking about 9 to 40 seconds. أيضا ال CBCT cyalography provides several advantages over the conventional cyalography, include three-dimensional reconstruction, allowing for manipulation of image rotation, a slice thickness, generation of various cross-sectional slices. Overall, it appears to offer an improvement in imaging of salivary gland ductal system over conventional cyalography. Now for serologic evaluation, no single definitive laboratory test for the diagnosis of Sjogren's syndrome, but a combination of abnormal test results is frequently observed. First indicator لأني inflammatory condition in the body هو ال ESR. Of course, it will be elevated. Mild normocytic anemia, leukopenia, autoantibodies are present in the majority of Sjogren's syndrome cases. Elevated immunoglobulins, particularly IgG, rheumatoid factor, طبعا الانتي-nuclear antibodies اللي هي specific للشوغرن anti-SSA and anti-SSB, strongly indicative. The most proposed classification criteria for Sjogren's syndrome by the American College of Rheumatology requires at least 2 of 3 criteria for case definition, one of which is a positive serum anti-SSA or anti-SSB or a positive rheumatoid factor and anti-nuclear antibody. هذا طبعا بالإضافة للclinical criteria. Okay, we will start from the developmental abnormalities ونمشي بالdisorders اللي تخص salivary glands إلى حد serious problems اللي هي tumors سواء benign أو malignant. بالنسبة للdevelopmental anomalies, it might be either complete absence, aplasia or agenesis of the salivary gland, which is rare, although it may occur together with other developmental defects. Accessory ducts are common and do not require treatment. هذه هي خلقية أو بالولادة، وعادة تصير ضمن syndromes. الموضوع الثاني هو aberrant salivary glands are salivary tissues that develop at unusual anatomic sites. Ectopic salivary glands have been reported in a variety of locations. مثلا بالmiddle ear نلقى glandular tissue أو external auditory canal بالneck posterior mandible أو بالanterior mandible. Pituitary gland and cerebellopontine angle. هذه هي usually incidental findings and do not require intervention. We have what is called the Stephen-Bone defect or the Stephen-Bone cyst, is an asymptomatic depression of the lingual surface of the mandible, often associated with ectopic salivary gland tissue. However, it is not a true cyst لأنه ما عنده epithelial lining. The most common location of the Stephen bone cyst is in the region of the third molar inferior to the mandibular canal diverticulum. By definition, الdiverticulum هو pouch أو sac protruding from the wall of the duct. هذه هي structures الموجودة بالduct of the major salivary glands often lead to pooling of saliva and recurrent sialadenitis. يعني الانفكشن على طول تصير بالsalivary gland. Diagnosis by sialography. Patients with diverticula are encouraged to regularly milk the involved salivary gland to promote salivary flow through the duct. Now we have the Darier's disease. Salivary duct abnormalities have been reported in Darier's disease, or what is known as dyskeratosis follicularis. Sialography of parotid glands in this condition revealed duct dilatation with periodic stricture affecting the main duct. Symptoms of occasional obstructive sialadenitis have been reported during this condition. We'll come to the end of this part of our lecture. Next time, inshallah, we will discuss the salivary stones ونكمل بالdisorders of salivary glands.